Hi, Kate Collins, staff scientist here from TELUS World of Science, Edmonton. I am joined today by Dr. Anne Bissonnette, who is the Associate Professor and Curator of the Anne Lambert Clothing and Textiles Collection at the University of Alberta. Anne noticed that ideas for homemade face masks are everywhere, and so she wanted to help people figure out which patterns are best to use, but by looking at the science. So she's here today to talk about some of her findings. Thank you so much for joining us today, Anne.
My pleasure, Kate.
Wonderful. So to start off with, I was wondering what got you interested in this project?
Well, I'm from Montreal, which is the epicenter of the novel coronavirus in Canada, unfortunately. So my large extended French-Canadian family lives there, and I'm worried about them. So according to the La Presse newspaper, Montreal was the 7th deadliest place in the world for daily death on May 10th.
Wow. No, that makes sense. That, yeah, we're seeing it hit hard across the world, but even here in Canada, there are places where it has been hit really hard.
Mm-hmm.
So knowing that it's not mandatory currently, why would you recommend that somebody wear a non-medical face mask when out in public?
Well, because any one of us may be asymptomatic or pre-symptomatic. That means that I have the virus, but I have no symptoms. And I'm ignoring that I have this contagion with me, or I have just been infected and it may take a few days to realize that the symptoms are out. So in an article from May 29th in the New York Times, it was reported that some studies showed that people who have no symptoms, so asymptomatic people, seem to have viral loads, that is the amount of virus in their bodies, that are just as high as those who are seriously ill. Additionally, coronavirus patients are known to be most infectious 2 or 3 days before symptoms begin. So if I'm sick, I know it and I stay at home. But if I don't feel sick, then I wear a mask when I go out. I may be just as dangerous as a person battling the disease or more. So stopping the transition is the responsibility of all of us.
No, that's really impactful. And I think that is one of the really interesting things is that there are so many asymptomatic carriers with this that you can't trust that you actually don't have the COVID-19 just because you're not showing it. Yeah. So do you know if there's research that's currently happening on the effectiveness of homemade face masks?
Yes, there's actually quite a bit of research. And I started reading scientific article in April when the Center for Disease Control in the US revised their policy about the use of face masks for the general population. So this came as they realized the important number of asymptomatic people that communicated the virus to others. So there is scientific research, it's accessible, you can go to Google Scholar, but it's a bit heavy to read at times. Still, I found that there's a lot of interesting stories about very simple face masks that go all the way back to the pandemics of 1910 and 1918. So one of my favorite story is from 1910, where this young Chinese doctor called Wu Lin-Ti was sent to a region in China where an unknown disease was killing most of the people who got it. And it turned out to be pneumonic plague. So he figured out that it was spread by air, just like the coronavirus, and that as a result, he developed this mask that was made out of packed cotton fibers, about like a 1.3 centimeter in thickness, encased in very loose cotton gauze. And that was way more substantial than whatever was used in the West. And this French doctor arrived and he explained this to the French doctor, and this guy treated him with racial contempt and refused to wear this kind of mask. He died within a few days. Wu's effort on several fronts led to the containing of this pandemic, and he lived until age 80. So what we have here is one of these stories that shows something to us that I think we've forgotten with time. But I must admit that a lot of engineers, mostly engineers, have looked and tested masks. But most of the masks that have been tested are what we call N95 respirators and surgical masks. And these two follow very specific standards. What happens with homemade face masks is that the supplies that people have accessible to them at home vary really, really widely between one household and the next. So there is no standardization. And that makes it very hard to verify and reproduce results, which is at the core of the scientific methods that scientists use today. So another problem that we have besides standardization is that a lot of the engineers that conduct these tests are not people who know or have a great deal of awareness about fabrics. So they'll look for fabrics that people have at home, and they may explain, and that has happened in a few very good research, but they will say how they've tested scarves, for example. Well, I don't know about you, but any piece of fabric can be cut into a rectangle and wrap around a person's neck, and that's a scarf. So this lack of knowledge or interest for textile is a problem. Many engineers will use terms of use, scarves, tea towels, for example, as opposed to what they should be focusing on: fiber composition, weave structure. So it's different to have like a loose, plain weave cotton gauze like Wu had used in China, compared to tightly woven denim, for example. So it's obvious to me that they have to pay more attention to textiles. And as a result of this lack of understanding, a lot of the research is faulty.
Okay, well, that's really interesting to hear that homemade face masks have helped with plagues in the past, going back all the way to 1910 from your research. So that's cool to hear that they've been used for a really long time. But yeah, it also, I can see how there is the downfall there, where with everybody making these masks at home, you're getting very, very different quality. I mean, even just thinking about a scarf, a winter scarf versus something light and summery that you might wear in the springtime will provide very different levels of protection.
Yes.
So from your review of all of the research, what are your recommendations for what a homemade face mask should accomplish?
Well, that's an excellent question. So first we have to define the primary use of these homemade face masks. And then we can evaluate their effectiveness and how to construct them. So the primary use of homemade face mask is to keep the germ of the mask wearer from spreading to others. So this is not the same as a respirator that aims to prevent the inhalation of virus particles a wearer will breathe in. So what we have is an idea that masks are only, first of all, one measure of many things that people must continue to do. It's not a solution by itself. We have to stay home as much as possible, so your germs stay there with you. We have to practice social distancing when we are out. In ventilated areas, for example, we have to be careful. Some people sneeze and things project very far, even through the use of masks. We have to wash our hands. So all of these measures, I'm not going to go through all of them. I think a lot of people know them, but all of these measures should be taken into consideration. So, all right, when we get back to the mask, so any mask is better than no mask at all. Ask anybody who sneezes in their elbow to see how droplets will go all over the place, right? The elbow will not contain much. So the most important thing for people to remember, and the scientists are very clear on this, is breathability. It is crucial. So some scientists, because they're not all in agreement, will say the more layers of fabric, the better. But that is false, because excessive layering of fabric can backfire, and the air will take the path of least resistance and bypass the filtration of your mask. So that's an issue. You may have the best filtration, 35 layers or whatever, but the air will go in other places. So number one. Number two, what I found from my research is that this, what we call a pocket style mask. So here, for example, is a mask, and you see how it opens up and it creates a little pocket on both sides. So this pocket size will allow the insertion of a non-woven textile. So here, for example, is a piece from absorbent paper towel. You may also have coffee filters. So there's different types of nonwoven. And this nonwoven in some ways is similar to Ti's Chinese thick cotton pads, because a lot of these nonwoven textiles, well, not a lot of them, all of them have these random fibers that are oriented in different places. And this creates a very complicated path for the virus to go through.
So after all of your research, you have recommended a mask pattern on your website. And so I was wondering, how did you land on the design of that mask? What features does it have? And is there any reason that you chose that pattern to base your design off of?
Yeah, well, one is the most important, in my opinion, this pocket that allows the nonwoven to be put through. These masks that are very popular nowadays, I see them a lot sold at grocery stores, that have a seam down the front of the nose through the mouth. When you think of how small a virus is, you have a seam down the front. So between the two parts, A, it doesn't allow for little pockets, but B, it also creates all these openings that a virus can go through. So that's a bit of a concern. And even though I appreciate the fit of this mask, because it gives more room for your nose, this one enables me to have no openings or no seam down the front. So that's good too. One of the main things that I wanted to do as a person who wears eyeglasses, and there are, I think, 2.2 billions of us out there, is that a lot of the masks would have such poor fit that they would create all sorts of fogging in your glasses. So I was trying to figure out how to adapt to this. And I must also admit that a lot of people in my families, my mother included, had trouble breathing through very tightly woven layers of cotton. So I had to figure out how to make different versions for different people that have different issues. So my mask is based in some ways on the Government of Canada's mask, the one that is sewn, because there's two other versions that are not sewn. And it has, instead of having a seam in front, which the one in the Government of Canada does, it solely has a pleat on top. So there's only 2 layers as opposed to 4 layers of fabric. And my glasses will go very easily on top of this, and they could be put in addition on top of the mask to create this seal on top of them. But everybody's glasses is a little bit different. So here I'm going to show you another mask here that's the same pattern, except it has this little opening on the hem of one of the sides. And in that hem, I've included a wire. And this wire is from this very typical paper clip, 3 centimeters long, that I've reshaped to go around my nose. So I've inserted this little paper clip in the opening. I can take it out before I wash it. And I will put the fold down, and I will put the paper clip on. And you can see that with my glasses, again, different with different people, that accommodates the wire. So it creates an even better fit than if I don't have the wire. So there's the option. And so here I'm explaining to you the different front and back, same tightly woven fabric. And for my mom and other people who have trouble breathing, there's a tightly woven fabric on one side and the addition of a really loosely woven fabric. So for example, if you can see here, you practically see me through this. It's very loosely woven, while the other ones here, you don't see or barely see my hand because there's a tight weave. So I'm using, instead of having a long rectangle, such as this piece over here, I've split the rectangle in 2, and I've put the seam slightly off center so that I could still have 2 layers of fabric underneath the bridge of my glasses. So that's basically, it's pretty simple. Most people can do it. They don't need a sewing machine to do it. Yes, there are other masks. They haven't been tested. I'm actually looking forward to the research that's being done, people testing different types of masks. There's interesting origami masks that enable a little bit of this non-woven fabric to stand out, and what we call a pressure drop to be different than a face mask like the ones that I've made. So the research will evolve. The research will continue to test, hopefully with the collaboration of textile scientists who have knowledge and understanding of textiles and fibers.
That's really interesting. But yeah, it seems like at the end of the day, the most important part is that everybody is wearing a mask when they are not able to socially distance at places, say like the grocery store, where it's much harder to stay away from people.
Yes, I think we all have to be part of the solution to this pandemic by wearing a mask.
Well, thank you so much for joining us today, Anne. That was really fascinating. I feel like I learned so much about, especially to do with the different weaves and how that's really important for making your own homemade face mask and just making sure that you have that really good seal so that you're protecting other people from your germs when you are going out in public.
So essentially, it becomes 3 layers, and test them before you start to make your mask. Do the highest tightly woven fabric that you can actually stand between the front, the sandwich inside, and the back. And if you find it hard, put a looser weave fabric and get to that point where it's easy to breathe, but it also protects yourself by not touching your own face, but mostly everybody around you.
Okay. Well, thank you so much for joining us today, Anne. I really appreciate you taking the time to tell us about all of the research you've done.
Thank you for inviting me, Cate.